we move on. I would invite Mr. Ozer to formulate the question at the end of the conference, because we are a little bit late. So I will introduce you, our first discussant, Mr. Hopkins. Please, you can, okay, we can manage your slide. Will add a valuable contribution on the use of bibliometrics as a way to explore the innovation diagnostics into the cancer research area. So we are ready now to begin with this new session. Okay, you can take the floor, Mr. Hopkins. Switch on the microphone, please, so that we can hear you.
Yes. Can people hear me?
Okay.
Hello?
Hello, hello.
Can you hear me?
The volume is
You hear me okay?
Okay, okay, perfect. Now it's okay.
Yes.
So you can speak.
Okay.
You can, we can hear you. Okay.
Okay. Thank you very much for the invitation. I'm very pleased to be invited to talk about this research. I'm afraid that the title of discussant in my case is maybe a little bit deceptive, because I'm going to talk about bibliometrics, but I'm going to talk about a different project not directly related to the previous presentation. So if we could have the next slide, please. This is work that I'm conducting with colleagues in SPRU, and it's part of a European Research Council grant supported by the ERC, and it's a grant held by Stuart Hogarth in the Sociology Department at the University of Cambridge, and my team in Science Policy Research Unit at the University of Sussex is conducting the bibliometric analysis to support this study. The project is called Cancer Screen, and the aim here is to understand within 3 different areas of cancer, 3 different disease areas, what is the engagement of industry. And we are expecting, in particular in the areas of diagnostics, to see more engagement of industry in publishing, with industry investing more and becoming more involved in innovation around diagnostic tests as a result of some trends. One of these is the increasing utility of molecular genetics for diagnostic innovation on the scientific side, but also some important factors in the business environment, such as the ready availability of patents, intellectual property around naturally occurring molecules, which has been a particular feature in the US and in Europe as well over recent decades. So we're studying that trend and the impact that that's had on diagnostic innovation. So if I could have the next slide, please. What I'm going to show you is some activity around publishing. Of course, a relevant question people often ask is, well, do firms publish? Don't they like to keep their research secret? But of course, we know from the literature, there's a lot published on studying trends in industry publishing, and there are many motivations as well that are revealed from the literature as to why firms will publish, or why scientists within firms continue to publish despite being also motivated by some commercial drivers. They still want to be part of the academic communities that they came from. They still value collaboration with academic authors who would wish to publish their research. Often biotech companies need to signal to their investors and to other stakeholders also the quality of their research. So there are various reasons why they would choose to publish. Could I have the next slide, please? So this is an example, a case in point, which we've studied in our previous research. what you can see here are 6 co-authorship networks relating to different time periods from the 1990s onwards for a company called Digene. This was a company that was founded in the US by some scientists who are interested in the role of human papillomavirus in cervical cancer, and the scientists worked with that company to develop a series of diagnostic tests which have really revolutionized screening services in the area of cervical cancer, displacing in some uses the established PAP test, which was for a very long time used for more than 50 years. And what we see from these maps is that this company, in seeking to establish a new diagnostic testing service, worked closely with a range of authors in different continents to conduct some large-scale clinical trials and also a lot of basic research. And really key to the success of their product was ensuring that they had this large network of clinical collaborators, which is what this research helped us to show. So what we're going to do now is move beyond that and look at some other examples from other cancers beyond cervical cancer. So if I could have the next slide, please. So we look at 3 different levels in the cancer screening project. We look at whole cancer fields. We look at lung, prostate and colorectal, looking at the macro level, looking at all of the publications we can identify through a combination of PubMed and Web of Science. We look at the meso level to look at activity related to diagnostic testing, and within that we can use mesh terms which allow us to focus on particular applications like early detection and screening. And we also look at the micro level to look at the activity of individual companies, as we have done previously with Digene, and there's the picture on this slide is an example of another firm level network. If we can have the next slide, please. I'm going to talk now about some of the high level clusters. I think we can skip this slide and move on to the next one. This slide just sets out the combination of mesh terms and keywords that we use to define cancer screens. But if we go to the next 3 slides, we can just sequence through these quite quickly, I think. So this one shows lung publications in the 1990s, and the next one shows lung publications a little bit later, slightly overlapping. And finally, if we could stop on this one, we see lung related publications up to 2015. And in that progression, what you see are some clusters very much along the lines that were highlighted in the previous talk. We have these clusters, but they're not entirely stable. They're evolving over time. Their connections with each other are evolving over time. And what this is showing is how in lung cancer over the years, we have seen actually a huge increase in the number of relevant papers, huge increase in the number of nodes that you can see on this map, which relate to particular terms. And what we're seeing is some areas becoming more dominant. So in the green and the yellow cluster, we see a lot of activity around what I would describe as more sort of basic science. This is becoming a greater proportion of overall activity. If you look on the other side, you see that the red cluster in particular is more related to surgery, the purple cluster more related to things associated with non-surgical treatment of lung cancer. The blue cluster, which is in the middle, is related to broadly speaking, things associated with risks and so on, and risk factors for patients and so on. These are all becoming a bit more interconnected over time, but I think the key thing here is the growth in activity that we can see in this cancer field over the years. If we could have the next slide, please. What we then have been able to do is to very much along the lines that was described in the CWTS talk, identify those publications that are associated with industrial organizations, and we can do that in various ways. And of course, there's also some manual cleaning involved here. This is quite a large data set, overall of about more than 450,000 publications. We go through these to ensure that we're accurately assigning these to different groupings, and in particular, we're interested here to understand which publications are related to industry, either because they have an author in industry or authors in industry working with academics. If we could have the next slide, please. So what this shows, what these charts show, is in each of our different cancer areas, in colorectal cancer, lung cancer, and prostate cancer, the trend over time, the engagement of industry, authors working in industry in these different cancer fields. And actually, what you can see on the one hand, on the left, is you can see that in terms of proportion, there is not a strong growth in the proportion of papers that have industrial co-authors, except for in the area of prostate cancer. The blue line shows that there was a strong growth in roughly the first half of the period that we cover, more collaborative publications with industry. The red line shows actually a slow decline from about 2% to around 1%. The proportion of papers overall that involve industry authors only. And then if we go to the other side, you can see the actual numbers, the real numbers of papers in both those fields. And you can see in real terms, the number of collaborative papers is increasing. It's not increasing at a rate greater than the growth of the scientific fields overall. So what I suppose you can say is that industry continues to be active in publishing, but proportionally more of their actions now are as collaborators on papers rather than papers written by industrial authors in their own right. And of course, we could discuss whether that is a good thing or not. But the context here is very large increases in cancer funding across the world, but very large increases in cancer funding by the public sector, and then you can see industry engaging with that most often through collaborative papers. Okay, if I could have the next slide, please. What I was showing you previously there was what I call the macro level. So this is at the level of the whole cancer field. We can do similar studies looking at the meso level, which is just diagnostics, and then at an even finer grain level, which you can see in blue, which is the publications relating just to areas like early detection and screening. There's more peaks and troughs because the data is more lumpy. There's many fewer publications in that area. But overall, it's kind of showing a similar thing, which is that overall the proportion of industry co-authorship is kind of relatively stable over time. Okay, and so if we could go to the next level, the next slide, what we're beginning to do now is look at the stories of individual companies that are active in diagnostic innovation. And here I have a couple of statements from the websites of two companies engaged in diagnostic innovation with a particular focus on colorectal cancer. They're both trying to develop screening services or innovations related to the screening of these cancers. Exact Sciences on the left is a US company which talks about collaborating on blood-based patient-friendly cancer screening and diagnostic tests. On the right side, you have Epigenomics, a German company, promising to do much the same thing. They're both founded in the 1990s, they're not too different in terms of age. But if we can have the next slide, we can see how these two different companies measure up in terms of their publishing activities. So you can see there on the right that epigenomics has this sort of almost dual structure. They have many publications with a collaborating network in Europe, but they also have a network of collaborators in the US as well, which you can see with the sort of the two networks they have. Exact Sciences on the left has a network which is more sparse. If we go to the next slide, the different colors are representing collaboration with different countries, by the way. Here, what we try to do is we look at the collaborators each company has over time, and what you can see is these blocks on these charts represent repeat publications with a particular entity over a number of years. So, for example, at the bottom of the blue chart on the left, you can see Exact Sciences has repeatedly collaborated with the Mayo Clinic. It's rather small on the slide, but that organisation, you can see they've worked with relatively frequently. If you look on the right side, you can see that there are a number of lines in the data which indicate, horizontally across the chart, repeated collaborations by epigenomics with the Charité Medical Center in Berlin, also University of Liverpool, and another university in Germany. So this shows us the extent of the collaborations that each of these firms has, and how they're using their relationship with a series of different external collaborators. If we could go to the next chart as well now, please, the next slide. This is another way of displaying the activity of these companies. You can see here the years going vertically down the page, and what we're seeing here are a number of green dots which relate to particular papers published by those companies, and then the blue lines show self-citation down the years and show how the prior papers of the company are related to the next generation of papers that company has produced. And so what you can see for Exact Sciences is there's a very clear line of self-citation running down the page with a particularly strong focus, I would argue. And then on the other chart on the right, you can see epigenomics, and they have a more dense network of papers. That they have a number of papers on the right side which don't seem to be connected very much to anything, but then they also have a body of work that their scientists internally are citing over time. And I would
Michael, sorry to interrupt.
Please do.
Just in terms of time, we are really running very late.
I will stop there. Actually, this is my last slide, but it's fine. Please if you can leave it on that slide if there are any questions. But I would challenge the audience to just suggest, if you show the self-citation slide that I was just talking about, I would challenge the audience to say which of these two companies has the better performance, because it's very clear from the bibliometrics that Exact Sciences has a much lower count in all levels of activity than epigenomics. But actually, in fact, it's the US company with more focus which has done much better commercially.
Okay, thank you very much, Mr. Hopkins. Sorry for the time we have. We must go very fast because we have other two discussants. I would invite Mr. Jarno Hoekman from University of Utrecht to share the screen and we can address the question better at the end of this part of the conference, if you agree. Okay.
Let me see. So I can.
So you can visualize. Okay.
So now this is in full screen, right?
Okay. Yes, that's fine.
Okay.
Then you can go. The floor is yours, please.
Thank you, Alessia, and also thanks to the other presenters for sharing their valuable research so far. So as a discussant, I would just like to share my thoughts on the policy brief and some of the thoughts that have been presented in the presentation. And okay, not doing anything right now.
Do you have some problem? Okay. Nice. Okay.
Yeah, there you go. So kind of when I read the policy brief and also knowing some of the projects that are going on at Center for Science and Technology Studies in Leiden, I thought let's just take a step back and think a little bit about what the actual kind of idea looks like. And then I came up with this this particular slide. On advanced bibliometrics and how to move to a more mission orientation approach, or how to link those two. And you could say the whole approach starts from the idea from a context where some policy actor kind of identifies a mission area. In this case, cancer as a mission has been taken as a case, but as has been suggested as well, there are other missions at the European Commission at the moment, including the one on smart city, the one on food and agriculture, and other missions. And there's also a clear idea that scientific research can contribute to kind of those missions. And from a science policy perspective, there's an idea that some interventions are needed to achieve a better mission orientation of kind of the system as a whole, so the innovation system as a whole, but also specifically the scientific research in there. And then in terms of what advanced bibliometric approach can offer, is that it's really about identifying a kind of a research portfolio that can that's the body of research that is there to support the mission or is in need of more of an orientation towards that mission. That's still a little bit unclear to me. I'll come back to that later. Then there is a step where this research portfolio can be characterized, both by using all the valuable data sets that are being developed within RISIS. And this is a nice combination of bibliometric and non-bibliometric data sets. The characterization then consists of thinking about the structures of the research portfolio, the dynamics, and the societal connections. And I think we covered all three of them. And then finally, this can then be utilized as a knowledge research actually in the policy cycle. And preferably this is done in a co-creative way where policymakers or stakeholders are not involved end of pipe, but are involved from the beginning, so already in the scoping phase as well. So the slides are a bit slow. Oh, there they go. Okay. So if you think about how this looks like in the policy cycle, I think there are two kind of phases in which these type of approaches can be very relevant. That is in very much the beginning of specific policy, so in the agenda setting, problem recognition, and documentation phase. And here the idea is really that the bibliometric approaches can provide comparative insights into the characteristics of portfolios, and also that they can identify or characterize certain missions in terms of research that are out there. And at the same time, which is a little bit less stressed in the policy brief, but is equally important in my view, they can also have more of a light evaluative function. Not in a very strong success or fail type of way, but in a way that you can kind of follow those research portfolio characteristics over time, and see whether some of these portfolio characteristics change following an intervention that focuses on more mission orientation. Now, the application area, I think, is very much looking at specific funding programs and other mission-oriented research policies and innovation policies that aim to connect science and society. What are the contributions of that approach? I think what is a real contribution that this links bibliometric approaches to a new innovation frame, an innovation frame of mission orientation, and inclusiveness and transformation, as Ismail Raffles already explained at the beginning. I think it's also a contribution that this relies on a very diverse set of bibliometric and non-bibliometric data to characterize research portfolios. So that goes beyond what has traditionally been done. I think a contribution is that this allows for a more granular analysis, both because the data set includes information on unique organizations and on funding agencies. That's something we have been missing so far within the bibliometric community. I think a contribution is that this provides for the opportunity for combining more mapping or bibliometric type of approaches with interpretivist approaches, potentially in collaboration with stakeholders. So that's the process of co-creation. And I also very much like and encourage the idea that this is to some extent also a modest approach with regard to claims making. So the idea is really to explore, whether we can understand mission orientation for bibliometrics rather than to give decisive answers in that respect. And next slide. Go. So I also do think there are a number of challenges, and those are should not be taken lightly. And I think the first challenge that I see is that the role of scientific research in my mission-oriented policy really depends on the nature of the problem or the nature of the mission, you could argue. And there's not, and also within certain missions, there's not always consensus on to what extent policy or technological solutions should be important. For instance, if you look at the smart city literature, there's a large debate on whether one should take that as a more of a scientific or technological approach, or to what extent this should be a more user-driven type of approach. And there are conflicts between different communities there. So the question, in a sense, of to what extent, what the role of scientific research is in mission-oriented policy, I think should be part of the discussion when using these bibliometric type of approaches. The second challenge is the demarcation of the research areas, and specifically the research areas that can support missions. I think in many cases it might be that some research areas that are relatively distant from a particular mission might still provide input in that mission, and it remains a little bit unclear what that means for how you can demarcate a certain research portfolio. For instance, if you think about the cancer example, many research into genetics might be very relevant for cancer research, but at the same time, they will not be picked up when focusing solely on cancer research, because this is captured under genetic research and not some on the general genetic research, and not so much within the disease-specific area of cancer. Third challenge is, I think, to understand research in terms of problem-solving activities. I mean, if one moves to a mission-oriented approach, the unit of analysis becomes the problem-solving itself, or the solutions that are being delivered, and not so much the research. And the question how research actually, how you can kind of characterize research in terms of solutions, that is not so easy, I would say. And finally, there's a question about what relevant demand or need-based benchmarks could be if you want to assess how which structures, dynamics, and social connections indicate and or contribute to mission orientation. So, for instance, the burden of disease has been used in one of the studies as a relevant demand benchmark, and of course, and this is being done with caution, but there are all kinds of questions in terms of what that indicate or in terms of mission orientation type of thinking. Having said that, next slide. We'll skip this one. I want to share some thoughts on how I think this type of analysis can also be extended to other domains. And I want to give 2 examples of that because, and I will do that as briefly as possible. So the first one is, I think that the analysis also lends itself to thinking in terms of proximities and distances, or fragmentation and coordination of research. And this is not very much of a new idea. And I think already in the discussion on mode 1 versus mode 2 knowledge production, there was kind of a central claim that addressing complex societal problems, or you could call them missions these days, should be achieved, or is generally achieved through collaborative and distributed modes of knowledge production. And this is then really about bridging cognitive, institutional, geographical, social, and organizational distances. So cognitive, one can think about interdisciplinarity or multidisciplinarity. Institutional, one can think about quadruple helix interactions between citizens, governments, academia, and industry. Geographical, it's about bridging or collaborating over longer distances or between countries. Social is between researchers of different types of communities, and organizational, I think that's kind of self-explanatory. And it has been previously proposed that one can use kind of a proximity framework to understand this fragmentation, or whether those distances are actually present, and also to see how this can be overcome in a sense, or how this is changing over time. And if you look at some of the applications there, which can also be of interest in the context of mission orientation, is that previously we have looked, for instance, at to what extent there are geographical biases in collaboration, and to what extent systems are more or less integrated at the European research area level. And another example is to look at the importance of different types of proximities in collaborative research on a particular disease field, in this case obesity, and then to see whether some of these proximities or distances are more present in the EU and the US. What you find then, for instance, is that institutional there's more institutional distance, or kind of less often or less collaboration between actors from different institutional environments, for instance, industry and government in the US compared to the EU. And this approach can also, these kind of structural insights into a research portfolio, in this case obesity, but can also be applied to other types of missions once a research portfolio is characterized, can also provide some input in how these proximities are changing, and whether you indeed see kind of more coordination of research efforts over time. So for instance, in a previous study, we looked at whether the importance of geographical proximity was changing, and found that the importance of territorial borders is indeed becoming less relevant in the context of the European research area, but the importance of geographical distance is not. But that will be an example of that. Now, if you look at it from a perspective of missions, you could say this, you could characterize missions or research approaches within missions. So for instance, the example was given of different research approaches to obesity, but also communities, as explained by Ed Noyens. So the different research topics which make up communities, you could characterize them according to the changing importance of proximity dimensions over time, or the importance of proximity dimension. You could also think about that different missions or research approaches need different proximity needs. So some of them you want to organize very closely to industry, others you want to organize, for instance, further away from industry. Some of them might evolve by large-scale collaborations across countries. Others might be better served by being geographically concentrated. So there's also a dialogue possible on these particular aspects. And you could also look at how different funders go about this. So how they fund particular type of research that can be characterized based on these characteristics. Moreover, a second approach, and that's only one slide and the last slide, is that I think in order, specifically in the context of medical research, in order for this research to advance, it's important to find a way of characterizing different types of solutions in medical research. In that respect, I also really support the work of Michael Hopkins, who looks into this in the context of diagnostic tests, which is a particular type of solution. And I think it's very important to kind of to understand what type of whether we can use bibliometrics to get an insight in what the relative importance is of different types of solutions within missions. For instance, one question is about the strong dominance of pharmacological interventions in medical research, which might be changing over time, and which might also play a different role depending on the diseases that are for which solutions are being developed. Second question is about whether we could say something about whether solutions are more upstream in the disease pathway, midstream, or downstream, and to what extent we can move from a more kind of treatment approach to more of a preventive approach, or particularly in very early stages of the disease pathway. And finally, and that might be the most challenging, is to see whether kind of we can also use these bibliometrics to say something about social material configurations of complex interventions. If you look at the medical research field, we see that interventions and solutions become more and more complex and involve configurations of material and social elements, often also living materials. Think, for instance, about gene and cell-based therapy. Cell-based therapies, that's a highly technological field, but at the same time also, if you look at community health programs, where there's kind of a mix of different types of interventions at play, both technological and non-technological. And I think there's an opportunity for these advanced bibliometric type of methods to try to characterize also these type of interventions. So that's from my side. Thanks for listening, and if you have any questions, I'm happy to answer.
Thank you very much, Mr. Hoekman, for having underlined the challenges and possibilities of bibliometrics analysis. I move forward to our last part of the session. So with the introduction, with the discussion of Mr. Lennart Stenberg from VINNOVA, Sweden's Innovation Agency. And we will forward all the questions at the end of this second session, if you agree, because there are many topics, many suggestions. So I would invite Mr. Stenberg to share the screen, perfect, and go move forward, and then have a discussion on, at the end of this presentation, because we have our virtual room until 5 o'clock. So we can go on with this illustration. Please, the floor is yours. Mr. Stenberg, welcome.
Thank you very much. Can you see my slide?
Yes, perfectly.
Okay, great. Okay, hello everyone. I'm talking to you from Uppsala in Sweden, although I should have been in Japan, but I'm stuck here in Sweden, which is, there are worse places to be. Thank you very much for letting me speak, and I'll try to keep within the 10 minutes if that is still okay for you. I'm speaking as a senior advisor and analyst at VINNOVA, which is the Swedish Innovation Agency. And I'm definitely not an expert or professional in bibliometrics, but I have been doing a fair amount of work still together with bibliometricians, and also myself sort of had the hands on the data, and actually benefited a lot from the clustering methods that have been developed at Leiden. That has been the algorithms, and the method has been implemented at the Royal Institute of Technology in Stockholm, and VINNOVA is financing some work there, and I've been the person very much bridging between the Royal Institute of Technology and VINNOVA. So I'm a bit familiar with the challenges of connecting such work with the policy issues, and that will be to some extent the focus on my presentation. A lot of rich material and ideas have already been presented, and I will only be able to touch on a few of them. And these are the sort of the topics. I guess the overall topic is the use of bibliometrics in research and innovation policy development, as I understand it. That's part of the purpose of today's meeting. And I'm very much in favor of the general approach of thinking of using bibliometrics as a means to explore various aspects of research in terms of organizational and cognitive structures and dynamics. I believe that has a lot to offer, and is a use of bibliometrics which is underutilized, and we've seen some interesting examples today. And of course, there are many internal challenges to doing such work, technically, and also in terms of the kind of data that is available. And I will not talk very much about that. A little bit about the challenge of capturing policy relevant research fields. But in order to make bibliometrics useful in the policy development processes, there are many other aspects that have to be considered than just the bibliometrics as such. And the conditions, I think, for this more exploratory use of bibliometrics the conditions are very different from those in evaluation. And my own opinion is that standalone bibliometric results usually do not suffice very far. So they have to be combined both at the end, but also during the whole process with other types of information and considerations. And this, as we've heard from Jarno, does really ask for co-creation with policy professionals, and sometimes together with area specialists. And I consider these partly different sort of communities. And that means that efforts have to be made both from the bibliometrician's point of view and from the policy professionals, in sort of the just to each other's demands. That means also to both have some understanding and skills that cross sort of the bridge over the different professions here. And I think still we have to be extremely modest and not oversell. And to some extent, I'm a little worried, I should say, about this linking it so strongly to being able to contribute to the missions. I come back to that. Data infrastructure, just want to say that I think that the initiative of RISIS is a great one, and I know, as I said already, that the CWTS has already made great contributions to development bibliometrics in various ways, including the clustering, as I mentioned. And I can just say there's a pity that there's no Swedish organization presently a member of RISIS. Hopefully that can be changed in the future somehow. VINNOVA is on the national level taking various initiatives to support data infrastructures, and maybe we can be of some assistance also for connecting the Swedish researchers with their colleagues on the European level. I'd like to take up one, which is a bit technical question then, but to highlight that, as that has been one that's actually brought me very much into becoming interested in trying to use bibliometrics more intensely than I did in the past. I think for a long time, the available means for capturing policy relevant research fields was not really adequate and not very useful, like journal categories, even keyword searches, I think left a lot to be asked for. So the cluster method has been, for me, though, quite important. But now there are, of course, there are also for certain fields, especially in the medical field, these called the topic cure databases, which actually people have classified articles and so on. And now maybe some new means which were referred to a bit in some of the presentation, text mining. So one question I have is really to what extent these methods have been systematically compared and evaluated in terms of their strengths and weaknesses, ways of combining them. And I myself encounter special challenges when it comes to what I would call research tools. I was a bit surprised that maybe there was not much more reference to the clustering method. One rather used others in some of the presentations from. So I think this is an area which I would like to see. I'm not familiar probably with all the work that's been done, but this I think is a quite important part of sort of what I would call almost the internal workings of bibliometrics. In terms of its relations or possible use for missions, I think we have to recognize that the whole concept of missions as an approach in innovation policy, I would say, rather than research policy, is a very recent development and is now about to become, one is trying to practice this. We're doing that at VINNOVA, and one is doing it at the European EU level and in some other countries. But we are really at a very, very early stage, and whether this will work or how it will work and what it will mean in the end, I think is very much an open question. So we cannot say that this is an established sort of policy approach, really. I think that's important. And certainly research, whichever way the mission approach develops, and it may be a bit different in different contexts, certainly research will play a role, and probably an important role. But as was mentioned by Jarno, it is really not for developing research as such, or knowledge production as such, but it is to solve real world problems. And there are also, especially if we look at the missions in Horizon Europe, there are very strict timeline. So maybe during the first years of the next 10 years that are sort of the timeline for the missions, the EU missions, one will be able to initiate some research that could have consequences for accomplishing the missions. That will only be the case in the first few years, and then one will have to rely on knowledge that's already there, and it's a matter of exploiting that knowledge. So I think that's very important in thinking about the possible use of bibliometrics for setting research priorities. I'm not so sure that is really an extremely important use of bibliometrics in this context. There is, as Ismail Raffles was mentioning, there's a general movement towards trying to link academic research to societal challenges. And I would distinguish that as a general trend from this particular policy instrument of missions. And I think and then the timeline is quite different. These are long-term issues, and I think the academic community is still struggling with trying to know how to relate to this and how to handle it. I mean, many are paying lip service to wanting to do this, but how do you do it? It is, for me at least, far from obvious how academic research can be geared more strongly to society challenges. There are so many sort of translations in between. But I think this is maybe, I would think that this may be a more relevant context in which to explore the possible use of bibliometrics than only thinking about, or more particularly thinking about, the mission initiatives as policy initiatives. So I would distinguish them a bit, even if they are of course related. Also, I think that there are many other ways than for using what I call here alternative bibliometrics, in the sense that was presented today. More maybe on the line that Michael Hopkins was showing, to look at looking at organizational, regional, national, and at national EU levels how the research is being organized. There are many important policy issues. Okay, coming closer to the end here, living up to claims. Yeah, I should say that I appreciate that the claims of policy relevance were rather carefully formulated in the various presentations. And certainly they contained a lot of interesting data, but I think still, from my point of view at least, what was presented was quite a way, still away from sort of identifying key policy issues and providing clearly relevant policy conclusions. And probably this should not be expected, and maybe that was not, probably that was not intended, considering also the need for co-creation that both I and Jarno has mentioned. And more specifically on this research effort versus disease burden, it's interesting to look at, but I mean, as was also said, you cannot draw much conclusion from it, especially when you look at the global data. I could go comment on that more detail, but there is no time. There is certainly no necessary connection. The question is, to what extent is lack of knowledge the bottleneck for preventing or cure a particular type of cancer? And I think that has to be, that is not, it's not the same for all types of cancer. Generally also, I think one has to look into why do governments fund research, why do individuals engage in research, and this, and on different levels, and this is very complex and usually dealt with in a fairly simplistic way. And I think there's a lot of room for more serious thought there. Connection with industry, I can say that in cancer research, for example, our leading company, or the only big company in Sweden, the UK based, but still has a lot of research in Sweden, AstraZeneca, has no oncology research in Sweden. What are the implications of that? But they have a big effort in cardiovascular and metabolic diseases. And the same, you can look at Denmark with the Novo Nordisk in diabetes, leading company. And their interest in that is even clearly spilling over into research efforts in Sweden on the other side of the Öresund at Lund University. So there are, when you get down to, especially in a small country, there are many things to consider. But certainly bibliometrics can be an interesting way of looking at those things. Connection with research, or research with societal processes. This is my last slide. I don't have much experience myself, except as it comes to industry connections. Certainly, I think that the point was very well raised about looking at the community level, where that should be then with if it's meaningful to look at the community level within a country, or whether it has to be done globally. That's a question. But generally, I very much support that. Connecting bibliometrics with other data sources that were presented sounds very interesting. I would like to understand that much better, and also the pitfalls. I heard a bit more during the presentation about the relevant set of policy documents. I was not aware of that. It's interesting. Industry, I think it works reasonably well. It's meaningful. Non-academic hospitals as a proxy for clinical research, I'm skeptical, I have to say. I like to be convinced of that. And even more so coming from a small country where a lot of stuff, most of the things are published still when it comes to research in English. The use of local languages as an indicator of local connectedness does not strike me as an obvious possibility. Maybe in Germany or France it will work, but not in Sweden. I wonder in the Netherlands how it is there. Okay, those were my comments. Thank you very much for listening, and thanks for all the presentations before. That really put a lot of thoughts and ideas, useful so in my head, and I appreciate it. Thank you.
Okay, thank you very much, Mr. Stenberg, for your contribution. I have a question from Mr. Ozer, and Mr. Noyons can answer to the question to save time. He sent to you the question by chat, I imagine. So the question is, with temporal dimension, I also mean that the relationship between two issues may be bidirectional. If the funding agency prioritizes cancer research, then researchers would focus on this topic to get the fund, for instance. With connectedness analysis, can we identify which of these two issues leads to other? Whether the funding agency decision cause a change in the behavior of researchers or not?
Yes,
it's a little bit complex anyway.
Yeah, well, I cannot answer the question. I mean, I cannot prove that this is possible. I think it will be possible. There's sufficient data and connections in order to investigate it in detail. So I do see the possibility here. And I think that even in another project where Ismail and I are involved, that we will like to look at this with regards to in terms of what the SDGs regards. So it's not really about funding, but it's also about funding because it's a kind of a mission. So it will support research on a certain topic. So that will lead to change in behavior in that sense. So I like the idea, and it's certainly worthwhile to follow up on. Yeah, but I guess that Emanuela wants to say something about this as well. That's my impression. Go ahead.
Yeah, thank you, Ed, for this. In fact, this is exactly one concern that we have in RISIS. So trying to say something about the strategies of funding agencies and how they prioritize research funding. This is exactly one key concern which generally is not really supported by data that can be analyzed in depth and possibly can be linked with results of research and performance activities. What we are doing is exactly trying to fill up data sets on policy instruments by the research funding agencies in different countries, trying to characterize these funding instruments also with respect to the priority and missions that they are devoted to. So we are progressing on this construction of the dataset, and we are hopefully will able to present something next year and also open to everybody the possibility to use this dataset, at least for the type of data collection that we will able to deliver at that time. Thank you, Ed.
Thank you very much, Mrs.
May I have one comment to Lennart, one of his last slides. So I think you questions whether non-English papers would relate to, let's say, local audiences, and that I guess that you were referring to the fact that even I mean, in the Netherlands or in Sweden and Scandinavian countries, people will publish in English anyway, right? Is that your argument or not? Is it different?
At least the papers that you will find in the Web of Science. I think you will find almost no non-English papers by Swedish authors in the Web of Science.
No, but that's actually one of the reasons why we should also look at this particular aspect at the level of the community, because the proportion of papers not in English are in the areas where also English papers are, of course. So if you as a Dutch institute publish in a circle in one of these clusters where there is relatively many non-English papers, it will probably mean that this whole topic that is represented by this cluster is more locally oriented than a cluster where there is primarily English papers. So by looking at the community and taking this characterization of the community as a kind of characterization of locality or a local orientation, it says something about the type of research that you're doing, even if you publish in English. That's the idea.
Yeah, I understand. And you have a point there, I think. Still, the question is if that is large enough a portion to be representative of the...
Yeah.
I know, for example, I looked many years ago at the robot research, or actually flexible manufacturing. And it turned out that in Germany, almost all the papers, actually the papers were not in Web of Science to begin with. That was the main problem.
That's of course an issue. So a lot of relevant research, and that's of course the caution, the disclaimer about these kind of analysis. When you base it on the Web of Science, you know that you're in principle looking at an international data source. So in the end, we will probably move to other data sources that are more inclusive in that sense, and where you can do this kind of studies in more, well, yeah, at least your coverage will be bigger, your inclusion will be larger. So you'll probably pick up more relevant research anyway. Yeah,
I think that's very useful, and including conferences, which is very important. Yeah. Although, of course, usually those are international conferences, so the language probably will be English, but at least you'll have a better coverage in other respects. Well, I understand. Thanks for your point.
Yeah. Okay.
Okay, thank you. Any reaction from the floor? Any other question? So, thank you very much for joining RISIS community. Then a special thanks to Mr. Noyons, Mr. Raffles, Mr. Yegos, and our discussant. There is another question. Sorry, would you be able to, from Nicola Dotti? Mr. Dotti, would you be able to extend the analysis to Scopus?
Well, not at the moment, because it's not so well curated in our institute as the Web of Science, but we are moving towards other data sources, and I think Scopus has a similar issue as Web of Science, because they have a different policy of including data, but it's still, I mean, the information that you can get out of it is basically the same as Web of Science, but it would be really great to be able to expand, for instance, including or looking at this from the database dimensions, which is much more inclusive, or other initiatives that now take place, like the open citation corpus, which has the potential of including much more data. But yeah, we could, I mean, in principle, we could do this the same for Scopus, and hopefully for any database on a relevant database available. But there's this issue of quality assurance. So we know very well, because we have been working with Web of Science for over, I think, around 30 years now, and put in a lot of effort in cleaning and improving, enhancing the data. And it's not so simple to superimpose that or to apply that simply to Scopus or another database. But yeah, in principle, it's possible. And as long as it's citation based, we can do this clustering, and we can create these structures, and then continue from there.
Okay, we hope so, Mr. Noyons. Thank you very much. I hope you receive point of view perspective, valuable insight from this very, very intensive afternoon. I thank again our discussants, Mr. Hopkins, Mr. Hoekman, and Mr. Stenberg, and you all. I remind that the policymakers' material will be available on the Nodo community space, on our website, and through our social media, and last but not least, to our mailing list. So I briefly remember your upcoming events in the mid of July, RISIS newsletter, application with all the news events for coming events, and then on September, our participation in ESOF 2020 for September, and 23rd of September, the 5th policymaker session dedicated to university classification with the study by USI, Università della Svizzera Italiana. Thank you to all again for joining RISIS community. I wish you a pleasant evening. Bye bye. See you soon. I hope soon in our next activities. Bye bye to you all. Thank you.
Thank you, Alicia,
Bye-bye.
for organizing. Bye bye.
Bye bye.
Bye bye.